All right, today we're going to do a focused deep dive on a heart valve condition that you don't hear about every day, but it's incredibly important: tricuspid stenosis. So, let's start with a basic question. What actually happens when a heart valve just can't open the way it's supposed to? You can think of it like a one-way door that's gotten jammed, and it's barely letting anyone through. Inside the heart, this creates a pretty dangerous traffic jam for blood flow, and we're about to see exactly what that means. So, what is tricuspid stenosis exactly? Well, it's a narrowing of the valve that sits between the heart's top right chamber, the atrium, and the bottom right chamber, the ventricle. This narrowing, this bottleneck, blocks blood from moving forward, causing a backup that can have really serious effects all throughout the body. Okay, so here's our game plan for this explainer. We're going to break it down into 5 parts. We'll start with just how rare this is, then we'll get into its causes and what it does to the body, how to spot the signs, how doctors confirm the diagnosis, and finally, what the treatment options look like. First things first, let's get some perspective. Even though tricuspid stenosis can be a very severe condition, the first thing you really need to understand is that, thankfully, it's pretty rare. And I mean, the numbers here really tell the story. In developed countries, we're talking less than 1% of the population. Even if you look at the entire world, it's still under 3%. So you can see right away it's not common, but for the people who do have it, the impact is absolutely significant. So if it's that uncommon, what in the world actually causes it? And maybe more importantly, what happens to your body when that valve narrows? Let's take a look at that chain reaction. Well, it turns out the why behind this condition really depends on where you are in the world. Globally, the #1 cause is rheumatic heart disease, but here in the United States, it's actually more likely to be a complication from a previous tricuspid valve surgery or from a rare condition called carcinoid syndrome. And for those patients who've had a valve replacement, this isn't something that just happens overnight. As you can see on this timeline, there's a lower risk period for about 7 years or so. But after year 8, the chance of that new valve narrowing starts to climb a lot. So it's definitely a long-term risk that needs to be watched closely. So, when that tricuspid valve can't open properly, all that blood backs up. It backs up into the right atrium and then into the entire venous system of the body. This massive pressure overload leads to one single major consequence: right-sided heart failure. And honestly, that is the key to understanding all the symptoms that come next. Okay, so we know the core problem is this massive fluid backup from the heart failing on the right side. So how does that actually look in a patient? What are the key things a doctor is going to be looking for? If you look at the classic findings, it all makes perfect sense. All that fluid congestion leads to swelling in the liver, or hepatomegaly, fluid building up in the abdomen, which is called ascites, and of course, swelling in the legs. You can also literally see the pressure backing up into the neck veins, which causes an elevated jugular venous pulse. This creates what's called a giant A wave, because the powerful right atrium is squeezing with all its might against a stuck, closed-off valve. And of course, there's the telltale heart murmur. And that murmur, it's a really critical clue for any clinician. You'll hear this diastolic rumble, but the key to knowing it's the tricuspid valve is how it changes when the patient breathes. When they take a deep breath in, more blood rushes back to the right side of the heart. This extra blood flowing across that narrow valve makes the murmur louder, and that's the classic sign that pinpoints the problem right there. Okay, so the signs are all pointing in one direction, but you need proof, right? A strong suspicion isn't enough. This is where diagnostic studies come in to give us the objective data we need to know for sure what's going on inside that heart. The first round of tests will give us some really important hints. An ECG might show that the right atrium is enlarged, which makes total sense given all that pressure buildup. And a chest X-ray can also show some big clues, like an enlarged heart and a swollen superior vena cava. Again, another sign of that widespread venous congestion. But, those are just clues. The real gold standard, the one tool that gives us the definitive answer, is the echocardiogram. It's basically an ultrasound of the heart, and it lets us see the valve directly, measure how wide it's opening, and track the blood flow using Doppler imaging. It's really amazing. The echo gives us our first hard number. It measures the pressure difference, or what we call the gradient, across that stiff valve. When that average pressure difference is more than 5 millimeters of mercury, we call it hemodynamically significant, which is just a fancy way of saying the pressure is high enough to really mess with normal blood flow and cause problems. And then there's the second crucial measurement, The echo can also measure the exact size of the valve opening. And when that area gets squeezed down to less than 1.0 square centimeter, well, that's what confirms the diagnosis of severe tricuspid stenosis. So when you put those two pieces of data together, a pressure gradient over 5 and a valve area under 1, there's really no doubt. The picture is crystal clear. The diagnostic journey is over, and you've confirmed a case of severe tricuspid stenosis. Now that we have a solid diagnosis, the big question becomes, okay, so what are we going to do about it? Let's walk through the different pathways to treatment, from just managing the symptoms all the way to a full-blown surgical fix. So the management approach is pretty logical. You take it one step at a time. First, you start with medical therapy, which is all about managing that main symptom, the fluid overload, using diuretics. Now, because all that congestion can actually cause gut swelling and make it hard to absorb pills, diuretics like torsemide or bumetanide are often a better choice. But ultimately, medical therapy is just buying time. It's a bridge to the real fix, which is surgery to replace the valve. Now, when it comes to surgery, there's a really important choice to make about what kind of valve to use. And for the tricuspid valve, bioprosthetic valves, the ones made from animal tissue, are almost always the way to go. Here's why. The right side of the heart is a low-flow, low-pressure system, and that environment puts mechanical valves at a super high risk for developing dangerous blood clots. Bioprosthetic valves don't have that risk, and as a bonus, they keep the path clear for any future devices someone might need, like pacemaker leads. So when is surgery an absolute no-brainer? Well, the guidelines are actually super clear on this. There are 2 Class 1 indications, meaning it's strongly recommended. First, if the patient has severe stenosis and they're having symptoms. And second, if they're already on the operating table for surgery on a valve on the left side of their heart. It just makes sense to fix the tricuspid valve at the same time. And let's wrap up with what might be the most important takeaway of all. Because this condition gets worse over time, any evidence of it on an echocardiogram means that patient needs to see a cardiologist for regular monitoring. It really drives home the point that the challenge isn't just about making the diagnosis. It's about figuring out the perfect time to step in and fix the problem before the heart starts to fail for good.